My name is Chris Howard, or Counselor Chris. I'm a substance abuse counselor and certified case manager interventionist. I think my experience is unique in the fact that I was a drug addict for about 10 years, and I've also had the opportunity of working in various different treatment realms. So in terms of working with families, and the reason why I started making content was I had this experience of being a drug addict who was in fact in a long-term recovery house, who ended up working in treatment, went on to become educated, went to UCLA undergrad, got a degree in psychology, worked with family systems for years. I created this page to help families and individuals navigate the treatment space and their own mental health and substance abuse disorders, and help them access the resources necessary to kind of get their life on track. I think it's important when I work with families that they understand my clinical orientation is really centered around working in long-term models. Majority of the treatment models that exist right now that are funded by insurance and various other state agencies are really driven by a medical model or an acute care model, which is essentially like a triage or urgent care for mental health or substance abuse problems. And often these do not work because they do not focus on implementing long-term lifestyle changes. And I think anytime I'm working with someone, I'm constantly assessing whether or not what their lifestyle's like, what their family system's like, what their day-to-day routine is. Do they exercise? Where are they at socially? Do they have a group of friends and community that are supporting them? So understanding that about me will help you understand what drives my philosophy and why I often suggest the things that I suggest. And the treatment system can be highly nuanced and complex. There's private pay institutions, there's state-funded institutions, more medical model institutions, social model institutions. So understanding that will actually help individuals make the most informed decision. And usually upon getting ready to enter treatment, when you're working either with case manager, an interventionist, a therapist, they'll do an assessment of needs to kind of get an idea of the scope, where the individual is at. Because if you think about it, a 17-year-old kid doesn't have the same needs as a 38-year-old executive who both are struggling with substance abuse. Those two people are going to have very different treatment experiences based on their life experiences, their coping strategies, their co-occurring mental health issues. So the main first step is really getting an assessment of needs. When you're doing this, you want to be looking into programs that really focus on personalization. And when I say personalization, like in general, there are certain aspects of treatment programs that are uniform across the board, but there are certain treatment interventions that happen within the context of these programs that are individualized. So the key factors to consider when looking into a treatment facility is licensing and accreditation. You want to make sure they're licensed by the state or the Department of Health Services. Usually families like looking into JCO. In my personal experience, I haven't seen that JCO actually certifies programs that are actually clinically better. They're better when it comes to documentation probably, but that doesn't necessarily mean that they're going to have some profound outcome because they have a JCO certification. So I think that's one thing in terms of the gold standard. People should understand it doesn't necessarily mean that you're going to have a better quality of care. JCO is a certifying body that credentials residential, hospital, treatment facilities across the board. The other thing you want to look into is the type of therapies that are offered. CBT skills, DBT skills, narrative-based therapy, TMS. Or do they have the set of tools necessary to help ameliorate your psychological or substance abuse problems? It's a major point to consider. Oftentimes people don't do really well in certain treatment dynamics because it's a therapeutic mismatch. What that person's struggling with and the clinical modality used to treat it don't jive well together. So I think those things are very important. That's probably a paramount thing to consider when you're looking into a certain treatment option. The other thing is staff qualifications. This can be a mixed bag. So I've seen a lot of places that have all of the staff qualifications, Harvard-trained clinicians, and they have absolutely poor outcomes. And they have poor outcomes because there's a relational component that the staff is often missing. And I think this is something you can only figure out often if you actually have an opportunity to go out and tour the facility and meet with the staff and meet with the floor staff and meet with the clinical staff to get a gauge on their intuition, their ability to handle situations that you might be going through with your loved one, or you might be going through yourself. I think that feeling of connection and the ability to foster a therapeutic alliance is fundamentally important for anyone who's looking into treatment. I think one thing that also goes unnoticed and not really talked about is what their position is on aftercare and support. Places that do not focus on aftercare and support typically have higher recidivism rates. I personally wouldn't want my loved one to go into a program that wasn't focused on some level of aftercare and support, whether that's random drug testing, alumni connection, having the client integrated into their support meetings. You want to make sure there is some aftercare support going on no matter what. I think reviews are one thing all families should take a look at. When looking at treatment programs, I think reviews say a lot. When you look at that, you have an opportunity to see what the community's like. You can see what their response is to families. Often if you just Google the program, you can see what Google reviews pop up. And typically if you Google the program, you can find up if there's ever been any lawsuits, deaths within the program, stuff like that. So making sure you do your due diligence to understand what's going on in the program is going to be paramount for you to have a better understanding of the type of environment that your loved one's going into or you're going into. This is probably the most important thing I think to bring up is financial considerations. I think because of the nature of what treatment is, often people go looking for help and think they're going to find it, and typically they don't, because the cost of treatment can range from Park Avenue to Park Bench. And what I mean by that is it can be $90,000 a month or $9,000 a month or $900 a month. And I think treatment services vary dramatically depending on where you're at within the national, based on different national regions. And you have to be mindful about what type of insurance you have. Does the facility take your insurance? If they do take your insurance, what's the estimate of days they see coverage based on your insurance? And what is the typical out-of-pocket expense that comes with that? I think these are things that people often don't consider and then end up in a position where the cost of treatment becomes something that they can't financially bear. In some respects, I've actually even seen it perpetuate relapse, because people end up signing up for this thing that is meant to be a lifeline in terms of them getting their life in order, and then they're in debt $20,000 or $30,000, and their mental health issues start to trigger up. They in fear and stress and anxiety as a result of all the money that they've thrown into various different treatment options. So make sure you do your due diligence when it comes to the financial considerations of treatment. Finding quality in-network options is typically better. They're hard to come by. Because of the reimbursement rate that the facilities receive, they typically can't hire the highest quality practitioners. They typically offer minimal services compared to other out-of-network providers who can have more white glove concierge services. One thing you also need to consider is being mindful of red flags. The red flags to consider when looking into treatment is people making promises about outcomes on human beings. Human beings are unpredictable. Typically, human beings who enter treatment are very unpredictable, and programs who make promises about specific outcomes and how they're going to be able to treat this individual is a major red flag. There's no way for them to know that. They can have an assessment call, they can talk to the individual, they can drive well, but once an individual is housed in a new environment and living with in the context of a community, a lot of times their maladaptive behavior springs up in ways even they don't understand. So I think anyone making promises is a major red flag. One thing that I think a lot of people also don't think as a red flag is when you go and look at a treatment program's website, is they have no staff page. You can't see who any of their staff is. Typically, these are what I call shell pages because they funnel into multiple different treatment centers. Call centers will run them and then farm them out to whoever has whoever's paying them most for leads. So if you cannot see who the staff is on a page, it's usually typically a red flag. And that doesn't mean it is. There are programs out there, I'm sure, that just don't have their staff on there for anonymity reasons or whatever it may be. I think it's a major red flag to not be transparent about who your treatment providers are. So with all that said, I think when you're looking into treatment options, you make sure first thing is you get your assessment of needs. Second is the major factors to consider: licensing, accreditation, staff qualifications, aftercare support, and success rates and reviews of the program. Number 3 is the financial considerations. You cannot bypass this aspect because it will impact your ability to even stay in treatment. So make sure you do your due diligence when it comes to that. And be mindful of the red flags. People making promises they can't keep, lack of transparency, you can't see who the staff is on the website, you don't know nothing about them. And if you actually have more questions and would like some more insight on that, feel free to reach out to us. There's a link in the bottom for you to touch base with us and see how we can help you or your family member on your journey. Thank you for tuning in. Bye-bye now.